Hello, my name is Alice Floyd, and I work in the Alabama Department of Public Health Center for Emergency Preparedness. And the reason that you're watching this video today is because you have been identified as a potential person to wear an N95 respirator. We have a grant capability called Responder Health and Safety that we get federal funds for, and in that we determine the different ways that we can help our employees, if they respond to a disaster, to be protected. One of the ways that we're doing this is with an N95 or a mask protection program. In the past, we have had this program, but now we are enhancing it. So we will be following some OSHA rules now that were not in place in the past, and we wanted to give you a little bit of information on the process to see how this is done. The hope of this information will be to decrease the amount of times that we have to do follow-up, missing calls, answering questions, and those types of things. So hopefully when you get through with watching this video, you will have a clear understanding of the process and the reason that we're doing this to help protect employees and volunteers should they be deployed during a disaster. So today what we're going to discuss is the purpose of the Respiratory Questionnaire form and provide information on the process for submitting the form. Some general information about the program is that at some point employees may have a need to use respirators or N95 masks to protect themselves from respiratory hazards during a response or an emergency. For example, a medical needs shelter, if somebody has a potential respiratory problem where we need to have respiratory protection, or if you're at a point of dispensing or in the clinic and somebody comes in that may have a suspect Ebola virus or some other highly infectious disease. Before being required to wear a respirator, we need to make sure that it's going to be safe for whoever does that. So we need to make sure that the employee that's identified to use one can do so in a safe manner. We do allow voluntary use for N95s. Some employers do not, but we will. So if an employee wishes to use an N95 mask when it's not required, a questionnaire still needs to be completed, training on how to don and doff an N95 and what they're used for, and fit testing should be conducted. And the reason for that is that although you may be wearing the N95 voluntarily, if you're not doing it in a manner that is safe, then you're not really protecting yourself and you could be putting yourself at danger. So even if you're not told that you will be wearing one of these, if you choose to in an event, that is something that would still require the complete process of the evaluation, training, and fit testing. ADPH will provide employees who have been identified as potentially needing to wear this N95 with a questionnaire. So that means we're going to actually provide a printed copy of the questionnaire for each employee to complete. This will be done through the area staff, whether it be the area nursing director or a designee, and the employee will be asked to complete that questionnaire in a timely manner because we will be coordinating this throughout the state. A physician has been contracted to review each questionnaire and will provide ADPH with a recommendation on the respirator use. So let me explain a little bit about that. This will not be a physician that is an ADPH physician. This will not be your doctor. This will be a physician that we have done a contract with who will receive the questionnaire via fax, and then they will review that questionnaire and make follow-up calls if needed or gather information if needed to make a determination whether you can safely wear an N95. This information and the questionnaire form should not come back to ADPH, meaning when you get through with completing and sending this form in, all we will get back is specific to whether or not you can wear the N95 or not. We don't want you to get this information back, this private health information, or we don't want that. So basically that's another reason to go through this process so that you don't have that information get out to the wrong people and that you secure it, and we're going to talk about that in just a moment. So we don't see the completed questionnaire. Again, I want to reiterate, that's not something that we're trying to find out is your personal health information. We basically are just trying to make a determination whether you can wear the N95 safely. The reviewing physician may contact the employee for additional information or clarification. Now, when you see the questionnaire, you can see it's multi-paged. Not all questions on the questionnaire have to be completed. There are sections that are mandatory, and for the most part, those sections have been identified as being mandatory by a line that goes down the right side of the page that indicates that this is a mandatory section. So when you complete that piece of it, if there's an affirmative or a yes answer to some of these questions, there's a requirement that the physician follow up. And that's not an ADPH requirement, that's an OSHA requirement. And basically, they just need to find out a little bit more information, or they need to speak with you to make that clarification about the safe use of the respirator. Just because you have a yes or an affirmative on a mandatory section does not mean that you're automatically disqualified from wearing one. It means additional information is needed. Certain sections of the questionnaire are mandatory and others are voluntary. And that means that if you've not used a certain type of respirator, or you don't have a history of being exposed to some of the chemicals that may be listed on here, you don't have to complete that. There's a section that the provider can ask you to complete if he needs additional information, and I'll go over that in just a little bit. Let me clarify that this OSHA questionnaire that we are using is a standard questionnaire. And that means that anybody in the other types of businesses or industries that wear N95s will be using the same form, potentially. So there may be things on this questionnaire that you say, I have no use for that, or I've never been exposed to that, I won't be exposed to that, that's not the type of N95 or the type of respirator we use. And that's because this is a standardized form. We took it right out of the OSHA standard, and rather than try to cut it apart, we kept it uniform. And the reason for that is that we don't want to piecemeal or pick and choose the questions that we wanted answered. We want to be following what the standard is, and this is the standard. So if there's a question on here that doesn't seem to make sense, that's because another person, another employee in a different type of setting, either construction or manufacturing or shipbuilding or whatever, welders and those types of people that have exposure to specific respiratory contaminants, are looking at the same form. So don't let it throw you. The healthcare side of things is a little more simple than some of the other industries, but again, we wanted to use the OSHA form. So the reviewing physician will not be treating or diagnosing employees that send this in, so I want to make that clear. If you think you have something that's wrong, don't write on the form a note asking, because basically he's just getting a snapshot in time of what your symptoms may be or diagnosis may be to determine whether or not you can wear the N95. This doctor that's reviewing this may call to ask questions, but that's for clarification. If you're not cleared to wear the respirator, other duties that don't require an N95 mask may be assigned during a disaster or an emergency response. As an ADPH employee, all of us are potentially going to be deployed to support a disaster or an emergency. Now, deployment may mean a whole lot of different things to a lot of people. We've identified medical need shelter teams that may need to use these depending on the patients that may be in there. We have identified employees that may work in a pod, and we're looking now to see at what types of pod or points of dispensing that may be at risk where we would need to put an N95 on the staff that's working them, the staff and volunteers. So as this program continues to grow, it will become more complex. So we just want to make sure that you know that if you are not allowed to safely wear the N95 from the outside physician, basically, it's not that you may not respond, it's just that you may not be put in a particular job where an N95 is required. So you could be asked to go to your office and do other duties, or go to an emergency operations center. And I'm not trying to get into all of that because that's definitely not my role. But I did want to make you aware that if you are not cleared to wear the N95 respirator, that doesn't relieve you of potentially having to respond in another way. So for the employee, what you need to do is to complete the form to the best of your ability and fax it to the number that's listed on the sheet. There is also going to be, when we print this up, a fax cover page. We have the physician that will be reviewing the forms. We have put his fax number on that form so that you have it. There's no chance of mistyping it or miswriting it. We've identified that this is the number, and all of the questionnaires should be sent to this number. Now, keep your information secure. You should fill this questionnaire out during business hours. Okay, that is one of the things that you would do as an employee, and fax it to the number that is provided. What you should do is keep this information secure so that other people don't get it. Don't leave the form lying around. And I would suggest that you don't just automatically get rid of it. And the reason for that is because if you have answered something on there that the physician needs to ask you about, keep that form handy in case he asks you to pull it out and reference it. In case, for some reason, a note that you may have put on there is not lined up with one of the particular questions, or if he asks you to complete the section of the questionnaire that's his determination whether or not you complete it. That way you don't have to go back and redo the entire form, and you and he will be able to see exactly the information that he's looking at. If you have additional comments or information, put that on that form. For example, one of the questions on there is, are you a diabetic? And if you are diabetic, but you use an N95 respirator to go out and cut the grass on the weekends because you may have allergies or you just don't want to be exposed to the dust, then that is something you could say. I have diabetes, it is controlled, and I use an N95 respirator. Whatever the comment would be, go ahead and include that. When we were talking to the physician about how this form will come into him, the feeling is that the more information that he has, then he's good with that. So rather than having to pull information out from having repeated calls and repeated contacts having to be made, go ahead and provide the information so that hopefully in that one review, and if he has to call you or make contact with you, that's done and there's not a lot of back and forth. So make sure you provide very good contact information, and you can have more than one phone number to put there if you have multiple phone numbers or ways of somebody getting in touch with you. And the reason I say that is because we don't want an extended round of phone tag going on with these. This physician will be looking at these on set days during the week, and we'd like to be able to have him to review one if he needs to contact you, if you have a yes somewhere or an affirmative and he needs a clarification on anything, that he be able to get you that first time that he reaches you. So don't screen your calls too much. If you see a number coming in and it's from the 205 area or exchange, that could be that physician that has a question about your questionnaire, especially if you're not from that 205 area. Don't just automatically discount it and not answer the phone. If the reviewing physician suggests a follow-up with your physician or a physician, that information is kept between you and the physician. That does not come back to me. And I'll show you the form that we'll be getting back after he reviews the form. Basically, there's just a couple categories of information that we would like to get. So if while he's talking to you, something indicates to him that you need to probably get seen by your physician, or if you have something that's of concern that you're not being treated for, or if he sees something in that form, that questionnaire, that is a concern for him, that's kept between you and that physician. We won't be made aware of that. If you request to speak with the physician or expect a call back, please answer the phone to avoid a phone tag. There is a question on here that says, has the employer instructed you on how to contact the person that will be reviewing the form? On the form itself, we have a contact listed. It's the office administrator for the physician that will be reviewing the form, and that's on there. So you can go ahead and circle yes, we've told you how to do it. That's a direct line to him, and if you've got a question about something with the form, you can contact them. If it is something on the procedure side of things, then you can contact me or your area nursing director. or the person that gives you the form. We think that this is going to go through the area nursing directors, and we will be working with them, or I will be working with them to help answer any questions that you may have in advance of this. So I just wanted to let you know, you do have the opportunity to ask a question, but instead of flooding the offices with a whole bunch of phone calls right to the doctor, call the number that's on there and you can leave a message and they will get back in touch with you. Information that's reported to us will be whether or not the employee has been cleared or not cleared, and any limitations that there may be for the N95. And the form that they will actually be using is this, and this may be a little bit difficult for you to see, but basically it has the employee's name, the area that they're working in, and whether they've been cleared to wear the N95, whether they've not been cleared to wear the N95, or any limitations that they have if they are cleared. So that could be something as far as time or temperature, that they may not be able to wear it over X amount of hours or whatever. That, again, comes from the physician's review of the questionnaire and possibly discussions with the employee, and that information is put on there, and this is all we get back, and that's what will be reported to the area staff for determining for deployment or response. Now, if we were to have an incident where we have the need to use volunteers, we would work with that provider to do an emergency contract or to up the number of reviews and have that questionnaire completed by our volunteers as well, because we want to make sure that they're protected as well. On the questionnaire, there are certain sections that are mandatory, okay? So when you get the form, you should have the facts page, that's the first, and then the first section is a lot of demographic information, and it'll ask where your public health area is, your height, your age, those types of things, and again, that's part of the medical evaluation. So Part A, Section 1, Part A, Section 2, those are mandatory, and you need to fill each of those questions out. Voluntary sections include questions 10 through 15, including Part B. And then I want you to know that the terminology on this may seem really simple for us that are in healthcare, but remember that this is also the same form that somebody that works in a construction area may use. So some of the terminology that you see, it may say diabetes and then sugar disease beside it. It may have some of the more common names of the medical diagnoses, and the reason for that is because not everybody may be familiar with what the medical names are. So when you see that, don't take that as talking down. That is just the common standard form, and we want to make sure that everybody has a clear understanding of what it is that the doctor is looking for. Okay, so once the employee has been cleared to wear an N95 mask, what we'll do is we will identify those people, and we'll have a training on how to, about our program, and then how to use the N95, and we will also do fit testing. If you don't have a good fit test, then the N95 is not going to provide the protection that you need. And you also need to know how to put this on and take it off with the other personal protective equipment that you may be asked to wear to protect yourself. So those things will also come along with it. Now, we're not going to do the training and the fit testing until you've been cleared. Okay. Again, this is new for us because in the past we have done the training, we have done fit testing, but we're going to go ahead and start looking at this higher standard of doing the program. And then if an employee is not cleared to use an N95, those response duties that do not require respiratory protection will be assigned. That will not be done by me or by somebody in the Center for Emergency Preparedness. That will be done by the area staff or by the county staff that's responsible for delegating response. And again, that may be something that you would like to talk to your employer about, your supervisor, or whoever does the deployment piece for your area. Okay. Now, just one thing that I would like to go back to is to say that some of the medical diagnoses that you see listed on the questionnaire may be something that you're totally not familiar with. In healthcare, we typically don't get exposure to things like asbestos or silica for silicosis and those types of things. So if you see a diagnosis or if you have a question about something that's on the form, that is something that you can ask the physician about. You can write a note on there, I'm not sure what this is, and they can get back with you. Those types of diagnoses and those types of exposures are further on down in the non-mandatory piece of the questionnaire. So if you just do the voluntary piece and if you just do the mandatory piece, you may be familiar with all of those types of things. And it's when you get further down into the more complex type of N95s or other types of respirators that you may see stuff that you're not familiar with. So other than that, hopefully it'll be an easy questionnaire for you to fill out. And it's asking also not only for diagnosis, but for symptoms. And the reason for that is because you may have some, if you don't see a doctor routinely, you may have some indications just from some of the symptoms that they're asking about that may put you at risk and in need for us not putting an N95 mask on you because of the ability that it could have to cause a problem, which we wouldn't want to do. But the symptoms that you have may be so subtle that you may not have gone to the doctor yet. So I hope that this questionnaire doesn't overwhelm you. That's not the intent. It's just to make sure that as we proceed with making our responder safety program stronger, to protect anybody that we send out to help in a disaster or a response, or to protect the staff if somebody comes into the clinic that has something that's potentially highly infectious like Ebola, that our staff is protected. Expect to see more training if you are requested to do this and get approved, and that may be through one of the area folks. It could be through a video, or it could be me conducting that. So I look forward to meeting you, and thank you for your attention.